A lot of women share that their migraine condition worsens, sometimes dramatically so, during perimenopause. Why is this?
Very simple answer. It's as women approach perimenopause, their hormones change from the much more stable levels, if you like, that we've had through our natural reproductive years. So by the time we get to beginning of perimenopause, usually in early 40s, then we start to get a little bit of hormone chaos going on, so that in particular the estrogen levels start to fluctuate considerably, and women will only produce the other female hormone progesterone if they ovulate, and ovulation becomes less and less frequent as we approach menopause.
And what is the role then of those hormones in migraine?
So with respect to hormones and migraine, and particularly with respect to what we see with menstrual migraine, we see that the natural fall, the drop in estrogen in particular, that is around the period time, can trigger off migraine with aura. And very high levels of estrogen have been associated with triggering migraine aura. So if we're thinking about this hormone chaos and women are spiking higher levels of estrogen at some times of the menstrual cycle, they might experience attacks of migraine with aura or just migraine aura on its own. And as they're heading towards their period or around their period time, perimenstrually, because of the higher estrogen levels, there's a bigger drop as a natural part of the menstrual cycle. And that drop, we know, is associated with triggering migraine without aura. Perimenopause is probably the most difficult time to balance the hormones out. So balancing hormones literally means that if we have identified that the natural fluctuations, the natural hormone environment, the fluctuations within it are a factor in triggering migraine, and particularly as those fluctuations become more variable in women getting to perimenopause, the aim is then to try and literally balance those hormones out. So provide a more stable hormone environment rather than the fluctuating hormone environment. So when we think about hormones, we often just think about our ovaries and we don't think about our brain. And estrogen is a very strong active hormone within the brain as well. The other thing within the brain is our hypothalamus. And our hypothalamus is where much of the migraine seems to emanate from. It's the master of our whole hormone orchestra, if you like. It regulates our menstrual cycle, it regulates our sleep patterns, it regulates our thirst, it regulates emotion. It's central, and it's also central to migraine. It's central to the drive of our menstrual cycle. So if we remove the ovaries, the brain is trying to look to send messages to ovaries that no longer exist. And so certainly temporarily, the brain goes into overdrive, it's lost its balance of things, and migraine will significantly worsen. To balance out the hormone, it may sometimes be necessary to actually switch the natural menstrual cycle off, to put the ovaries into hibernation temporarily and replace those hormones with more stable, non-fluctuating hormones. With the hormone replacement therapy, MHT, HRT, what we're doing there is often using, or nearly always, certainly in the UK, we use body identical estrogen, so it's structurally identical to the estrogen from a woman's own ovaries. And the second hormone that's necessary to protect the lining of the womb from excess estrogen, we will either use a body identical progesterone, or sometimes we'll need to use synthetic progestogens because they are for some women, better than the body identical progesterone. And those do not carry any risks really over and above what a woman's own natural menstrual cycle would be doing. Now, that's quite different from the contraceptive hormones, the majority of which use a synthetic estrogen, ethinyl estradiol, together with a synthetic progestogen that are used to suppress the release of the egg every month, suppress ovulation, and to essentially put the ovaries into hibernation. Whereas the MHT allows the natural menstrual cycle and ovulation, whatever the natural body is going to do, that still occurs. So with the contraceptive estrogens, they are shutting everything down. And contraceptive hormones are probably a lot safer than many women realize and can have many benefits as well.